Hello, everybody. Welcome to our webinar tonight. I'm Dr. Wells. Let me get my video up here. Let's see. Can I get confirmation from my team that you can hear me, please?
Yep, I can hear you.
Fantastic. So let's get my video up. All right, we've got people filtering in here. Fantastic. While I'm working on this, guys, I want to give you a little bit of preview about how tonight's going to go. Hi. Great. It's fantastic to see everybody here and welcome. We've got all of your mics on mute. Let's keep it on mute for a little while. I will be taking questions at the end, but I want to give you guys some information and some education first. Again, I'm Dr. Wells and welcome. I've got some slides up and we're going to go through those. And then at the end, I will open it up for questions. Now, take a second here and locate the chat, if you would. There's a little speech bubble that should be at the bottom of your Zoom. That's the chat, and that's a way that you can respond to the presentation, but also put in your questions. So just locate that so you know where it is, and then we'll get started here. All right, very good. Looks like everybody's filtered in. All right. I am pathologically punctual, guys, so I do want to get going. Tonight's webinar is called The Top 4 Things People Get Wrong About Their Sleep, and I'm going to tell you what to do about it. One thing is I really want you to get something valuable out of this teaching tonight. And at the same time, I want to give you an intro to my Super Sleep Academy Masterclass, which is coming up. This is something I've been working really hard on, and I'm super excited to present it to you. With that, you're going to find out how to work with me if you have a sleep problem that's a little bit more complicated than what Google or sleep hygiene can resolve. So I can help you with that. And it's kind of for people who want to take things into their own hands, kind of a take the bull by the horns kind of people. So stay tuned, and I will speak a little bit about that in the middle, but especially at the end. All right. So again, my name is Audrey Wells. I am a physician, an MD, and I hold board certifications in 3 different areas relevant to tonight. I'm boarded in sleep medicine and obesity medicine. And there's actually tons of overlap between sleep practices and diet exercise practices. So I think these 2 areas of medical specialty are very related. I have over 2 decades as a practicing full-time physician. I've seen about 50,000 patients in my career, and I'm very proud to say that I have enjoyed it immensely, and I consider it a privilege to be a physician. I've seen all severities of sleep disorders, all sleep disorder combinations, and I've seen how lack of sleep affects well-being. It affects your mental health, your physical health, appetite, weight, longevity, everything. Now, a fun fact about me is that I'm also a life coach on top of being a physician. And part of what motivated me to get life coach certification is that sleep affects your entire life. And sleep has emotional and behavioral components that are not addressed in the medical world. So, what I deliver is sort of wholesome and whole body ways to overcome your busy brain and long nighttime awakenings without knocking yourself out with pills or alcohol or sheer exhaustion. That's kind of my jam. Now, I would imagine if you're here, you're looking for something more with your sleep. You're probably fed up not getting results or not making progress. Many of you, I would think, either suspect that you have a sleep disorder or have been diagnosed with a sleep disorder, or even more than one, and something isn't working. Can't sleep at night, can't function during the day, too tired, even functioning in survival mode, and pardon the pun, but kind of putting off your dreams. Okay, so this is a situation where you might not trust your sleep anymore. But I know in general, people who show up to webinars like this value their health. And if you value your health, you know that sleep affects everything. Like I said, it affects your physical and mental health, but also your metabolism, your heart and blood vessels, brain function, and your energy levels. So this is really important work here. I want to tell you, you're not alone. Sleep disorders are so common, and many people feel stuck. And I'll get right in that group with you. I get it. And I've been there with sleep deprivation and sleep diagnoses. So I'm going to talk a little bit about that just so that you can understand where I'm coming from. So this picture here is on the day of my medical school graduation. So I was proud. I have a shiny new medical degree and I'm ready to go. But what happened next was I went through a residency program. And in my particular situation, I stuffed 3 years of training in residency into 2 because I did a research track. So I had 3 years of clinical medicine stuffed into 2 years. 100 plus hours per week. I was working really hard, lots of stress. I was in a medical specialty that involved the intensive care unit, and I had ICU call. And guess what happened? Well, I couldn't sleep well. I was sleep deprived, stressed out, and I gained a bunch of weight. This is me, 40 pounds heavier than what I should be. I actually didn't want to be in this picture. You can see how it's blurry. I was sitting as far away from the camera as I possibly could. And even though sleep is literally my area of expertise, I just want you to know that I have sleep problems because I'm a human being. And I'm wondering, does anyone here have this experience of just feeling like you can't get your head above water with all the things that you have to do and everything that competes with your sleep? If that's true for you, just type me in the chat so I know you're out there. Let's give it a shot. So this is me. This was in 2006. And I had to get on top of things. I got more sleep. I worked on my stress really hard. You can see I lost my double chin and I did some things to prioritize my health and I was thriving again. This is a picture of me in my private practice. I was chief medical officer of a big comprehensive sleep medicine clinic, and I loved it because I could do things my way, which I really enjoy. And then over the past few years, I've had some challenges, family stress, grief, menopause, including hot flashes and weight shifting around in some places I didn't expect. And, you know, one of the things I've always tried to do is walk a mile in my patient's shoes. And for me, that means getting the sleep studies, both the in-lab and the home sleep apnea tests. And I've tried all the CPAP masks. This is a picture with my favorite one of them. And, you know, in the past couple of years, I'm now capturing the beginning of my own sleep apnea, which is a little bit of a mind bender, but here we are. I'm capturing my own sleep apnea now. And so I'm going to have to deal with that. Now, all this personal experience, what it does is it gives me perspective and I have empathy in people with similar situations. And I know exactly what it takes to move out of a difficult time. And I'm pointing this out because I think you can tell, with my degrees and everything, I'm book smart with sleep, but I'm also street smart with sleep. And I just want you to know that because I think it helps to relate. Now, I want to tell you another thing I learned. Um, what I learned is that the medical delivery system is failing us when it comes to sleep care. All right, the medical delivery system is failing us. If you agree, type agree in the chat. I want to understand if people have had obstacles with the medical delivery system. And I'll give you an example. So I'm going to tell you about Stella. Stella worked in my sleep clinic. She was a respiratory therapist or RT. She knew a lot about sleep, and she worked a second shift in a hospital contract position about 3 days per week, in addition to her day job with me. She had a family, 3 kids. She was taking care of her aging mother and just felt overextended and overwhelmed. And she would say, I have to get everything done. And the thing that got sacrificed was her sleep. The problem was that because she was spread so thin and because she sacrificed her sleep, she was also sacrificing her wakefulness. So she was never really asleep and never really awake. She was working during the day, staying up at late at night, being a caretaker, being a mom. And she felt like she couldn't shut off her brain. Her body was tense. And she started having memory problems, like word finding difficulty or feeling like she was always missing something. And she was doing what a lot of people do, which is caffeine and sleeping pills, right? You're kind of looking for that coping mechanism that's going to get you through the day. And this is a situation that I like to call foot on the gas, foot on the brake, and that's going to wreck your transmission, right? So you've got the caffeine for the gas and the sleeping pills for the brake. She was irritable, barely functioning. I think you can kind of get the picture, but she really felt stuck, like she didn't know which end was up. And she talked to me about it because her work began to suffer. Once I understood what was going on, I started to counsel her and give her guidance. And with the proximity, she's right there in my clinic, I was able to personalize my recommendations for her situation and follow up with how those things were working or not working. And they were really things, that I felt wouldn't be solvable with internet research or, Googling, like I mentioned before. So this was a little different than what my patients were getting because typically with the waiting list and everything, I was seeing a person every like 3 months or so for 20, 30 minutes at a time. And certainly I was telling her the same stuff, but then she would more quickly be able to come back and report on what was working or not. And it was just an example to me of what could be accomplished with a high touch approach. So, what was the solution? Well, I want to point out that the first step was awareness, which is, really important because it kind of grounds you into what your sleep problem is costing you. And so, with Stella, we talked about this quite a bit, and she was not the person that she wanted to be with her mood, with her productivity, and just with the way that she felt inside. And the second piece of the solution is guidance. It's okay to know about the problem, but then the question is, what are you going to do about it? And she was really ready for effective and expert guidance. And so we had a really nice exchange with that. We talked about prioritizing her sleep, not really focusing on optimization at the beginning, but kind of getting her to a place where she could implement different tools just incrementally. And I helped her pick out just a couple of things that were high value changes and just focus on that. And these were adjustments that were meant to give her results, which then kind of fuels the motivation to keep moving forward. Other things that are necessary is support. So, support for behavioral changes, because behavioral changes are hard, and you don't have to think hard about doing behavioral changes around things like dieting or exercising. We all need support in the moments we're struggling, especially when we're sleep deprived. And again, patients just don't get that when they're seeing their sleep medicine provider every few months. So everyone is different. There's some tailoring necessary to figure out your own personal sleep program. And you kind of need a base of knowledge in addition to the support to figure things out. So it does require learning on your part, it requires experimenting. It requires figuring out what works and what doesn't. And this is often why sleep hygiene tips don't often solve sleep problems. They're superficial. And so you kind of need to dive down to the next level of support that's going to be more specific to your situation. Now, I want to say, don't make it too complicated. Just get educated, get empowered, and get support to figure out what works for you. And for Stella, what happened was, when she was able to nail it, she really got results. So her memory spontaneously got better, and she really enjoyed that feeling going away, that feeling that she was always missing something. She had better moods, less anxiety. She felt more present with her family. And she started to recognize herself again and work more toward being who she wanted to be. And that included being capable, being productive, and just having a sense of well-being in her life. Now, this is just one example of what I've learned over the course of my career, that people with sleep problems need more help than what the medical system is delivering. So, for example, you need to know what's normal, what's not. There's a lot of misconceptions out there. And I'm going to tell you about 4 of them in a minute. That's what this webinar is about. You also need to know if you're getting healthy sleep. And it's not as hard as you think, but that's something that's really good to confirm. Sometimes you need to know how to get out of your own way and start making some of those high value changes that I mentioned before. It's important to choose the right tools for the job, tools that fit your situation and your preferences best. And sometimes that looks like insomnia treatments, that may be treatments for sleep apnea, they may be combinations or just changes to your sleep environment or your thinking and beliefs around sleep. And then finally, to put some rocket fuel on the situation, I think it's always critical to highlight the importance of sleep and the fact that it's absolutely critical to your health. Why? Well, it's because your brain is your most important asset, and ultimately, sleep is for your brain. So all of these things are possible, and I want to give you some hope here. I'm going to introduce the Super Sleep Academy and who it's for. So Super Sleep Academy is the name of my program, but what it's actually going to deliver is how to finally sleep better and feel more awake. As a preview, I want to give you this knowledge and support so that you can get the around-the-clock guidance to put your sleep problem to bed for good. And this is for people who really want to do more than just eke their way through life, just trying to make it through the day. In this program, I address daytime behaviors that help or hurt your sleep. And it's not just a situation where I'm going to be nagging on you to put down your cell phone at night. We're actually going to get down to some better stuff. I also talk about what it means to get natural, wholesome sleep, or how to get back to it if you've been tossing back some medication more than you'd like. Thirdly, we'll review some other things that you put in your mouth. That includes food, drinks like alcohol and caffeine, supplements, over-the-counter things, and even some things that you might be shy about asking your doctor about. So I'm here for all of it, and you can give me your challenges. And then there's what to do if you still feel tired. Now, this is a super common situation where people expect that interventions for their sleep will automatically translate into feeling better and energetic all day long. But the truth is, people tell me all the time that even though they did this or tried that, they're still tired. And it's really common, and there are definitely things that you can do about it. So don't worry, I've got the answers for you, and we can get into some of that at the end of tonight's presentation. So if nothing else, I do want you to walk away with a message of hope here. I want you to know that your ability to sleep is innate. It naturally exists within you. It only needs to be uncovered. Even if your sleep problems have been there for years, even if you have more than one sleep problem, and even if you've tried everything, or so you think, in your heart of hearts, I think you know that this is true. Sleep should be wholesome and natural and pleasurable. And I can show you how to get back to that. Okay. If I tell you something tonight that makes a big improvement in your life, then, move on and call it good. The Super Sleep Academy is not for everyone. So let's get started with the top 4 things people get wrong about their sleep. And maybe this will satisfy your sleep issue. So first off is sleep need. This is kind of a nebulous thing, right? The question is, how much sleep do you need, and how do you figure that out? Now, you can reference things like this figure. You will see this in my ebooks and educational materials. What I'm showing you here with the yellow circle is that adults 25 years old and up need between 7 and 9 hours of sleep. And notice, seniors need just as much sleep as they always have, but the pattern may be different with aging. And that's something that I go into in Super Sleep Academy. But there's a big range here, right? 7 and 9 hours, that's a big range. And the real question is what you need as an individual. Is 7 hours okay? Or what would you feel like if you got more? Or what if you feel like you're doing okay, even on less? So here's the thing. If you're laboring under the impression that you should be getting 8 hours of sleep and you're only getting 7, that can stir up a lot of dissatisfaction. And if you're sleeping a really long time, like closer to 9 hours or even more, just realize that you may actually be compensating for poor quality sleep by trying to sleep more and extend that sleep period. Here's another thing I hear. I can actually get by on 6 hours just fine. Everyone, I want you to hear this. This is not true. And also, getting by is kind of a low bar to set yourself. If you're consistently getting less than 6 hours of sleep, the truth is you are eroding your health. Now, it's okay to sleep 6 hours every once in a while, but doing it with some frequency, such as every weekday or whatever, will cause you problems in the long term. One of my favorite sayings is, if you don't make time for your wellness, you will be forced to make time for your sickness. And you cannot just catch up with sleep on the weekend. Now, weekend naps are great. I love naps, but they're really, naps should be shorter. They're not really for making up the sleep you should be giving your brain every single night. And so I want to give you some perspective on what's normal. So when it comes to sleep need, everyone is a little different, but as an adult, that sleep need should be fairly consistent and you can figure it out for yourself. The vast majority of people, and I mean the vast majority of people, are somewhere between 7 and 8 hours of sleep need. Now, me, I need between 7 hours, 15 minutes and 7 hours, 30 minutes. I've been doing this a long time, and you too can get that granular if you really want to optimize the way you feel. But I think it really helps to narrow down within a half hour or so and really just nail down how much sleep you need. When my sleep schedule is dialed in and it's consistent and healthy, in other words, I'm not in a period where I'm battling insomnia or sleep apnea, I actually feel alert and energetic throughout the day. That would be a normal result of meeting your sleep need. That's the way it should be. So, this is worth figuring out, and I can show you how to do it for yourself. There's definitely problems with sleeping too much and too little, like I mentioned. But when you get it nailed down, dialed in for yourself, your brain and your heart and all your bodily systems are in harmony. And again, I know this is going to resonate for everyone who values their health. All right. The next thing that people get wrong about their sleep is interpreting what your wearable sleep tracker is telling you. Now, I would like to see in the chat everyone just put in tracker or put in ring or watch, whatever sleep tracker they like or whatever they're wearing now. This will help other people see what's popular. Now, I want to say up front, I love sleep trackers. I do. The sleep tracker has elevated sleep into our awareness, into our conversations. People are now paying attention. And I think it's really great to get to know your own sleep pattern, because if you're looking at it night after night, you can pick up on some consistencies and you can know when things go wonky. But sleep trackers are currently not as accurate as they claim to be. The information they put out is generally in the right ballpark. So you see, I've got these arrows in the bullseye right here. They're not really getting at the bullseye, but they're in the ballpark. I just want you to be careful to not give the information too much weight. Okay. I want to tell you what sleep trackers are really good at. They're good at identifying your sleep start time and your sleep end time. They may be okay at telling you how well you slept. It kind of depends if you are similar in your health and in your person as the group that they do the testing for the sleep trackers on. Okay. I think they're also very good at helping you to be consistent with your sleep schedule, that they give you that feedback usually. But sleep trackers are much less good at sleep stages, even though many of them claim to tell you how much time you spent in deep sleep, REM sleep, or how much time you had with awakenings. So I'd give this a fair rating. For the most part, I would take the sleep stages with a grain of salt. Lastly, sleep trackers are not good, and I would say terrible, in fact, at detecting sleep disorders. This is not a sleep test at all, okay? And it's important for me to make that distinction because I don't want anybody to have a false sense of security if your tracker is telling you something like no significant variations in your blood oxygen levels. This is really some false security. So don't ignore your sleep symptoms. If you are having a problem with your sleep, don't listen to your sleep tracker. Go get your sleep checked instead of that thing on your wrist or that thing on your finger. Make the decision. Okay. Next, I want to talk about nighttime awakenings. This is another thing people can get wrong about their sleep. So here's a situation where knowing what is normal can really help. And it's not necessarily normal to sleep throughout the night every night without an awakening. So people in their 20s do this commonly, but people my age and above typically don't. We're people who are more seasoned, okay? So with every decade that passes by, there are usually more nighttime awakenings. And I just want to point out, this is not necessarily abnormal. I'm going to give you my 3x5 rule. This is for the teachers out there. I'm thinking about 3x5 note cards. Okay. It takes at least 3 minutes of being awake to be conscious of it and remember it happening. And it takes you can have up to and around 5 conscious awakenings per night. That can be normal as long as you're not awake for more than 45 minutes to an hour total. More than that, and you're kind of eating into your total sleep time, and that's when it becomes a problem. Now, you can imagine if you wake up in the night and you think it's not normal, that you're not supposed to be awake, you could freak out, and that's going to mean you're going to be awake for longer. So I'll invite you to reframe your awakenings. You can wake up and think, oh, here's one of my awakenings. And you can roll over and just relax about it because now you know that it might just be normal. Now, if nothing changes for you after you have this knowledge, then you need to take the next steps to get your sleep fixed. Nighttime awakenings are incredibly frustrating. It's one of the most common things I'm asked about, and I know how to help you. Okay, fourth thing that people get wrong about their sleep: sleeping pills, as in sleeping pills will solve it. Now, this is a big lie, and I want you, if you're listening to this, if you're investing your time in learning about health, I want you to realize you can do better with just a little bit of effort. It's not as hard as you think to get back control of your sleep, and I can show you exactly how. You do not want to be dependent on pills. What you need is skills. And don't make the mistake of thinking that over-the-counter sleep aids are safer than prescription sleep drugs either. They are just as problematic. And I think common sense tells you the answer is not in a bottle, right? Whether it's a bottle of pills or a bottle of alcohol or a bottle of whatever. And something I talk about in my course is the emotional component of sleep. And that's something that's not really considered, but getting your mind and body both relaxed is a major part of learning to sleep peacefully. And I just hammer on this point a little bit because I'm going to tell you a cautionary tale about pills. So I had this patient named Brian. Brian came to see me with great reluctance. Okay. He had been battling his sleep problem for years. He had problems with staying asleep mostly, but getting to sleep was also an issue. And by the time he was in my office, he was on 2 different prescribed sleep medications and would still add over-the-counter sleeping pills to that. And he was still not sleeping well. He told me he had bought a $5,000 bed and fancy sheets and pillows out of desperation. What finally did the trick was his cardiologist persuaded him to come and see me. Why did he have a cardiologist? Well, he had atrial fibrillation or AFib. He had high blood pressure. And within the year before he came to my office, he had had a couple of TIAs. That's like a mini stroke or transient ischemic attack. And I remember he was pre-diabetic as well. So we had a long conversation on the first day. He didn't want to do a sleep study, but his symptoms and his medical history were concerning to me, and I knew we needed to take a deeper look. It's because the thing about sleep is that it's kind of like a blind spot in your health because you're unconscious while you're sleeping. So you're not aware of what's going on. And Brian finally agreed because he was getting desperate by that point. The sleep study showed incredibly severe sleep apnea. It was pretty bad. And the truth was, the sleeping pills had been masking it for years, and they were not doing anything to correct the problem. In fact, they were actually making the problem worse because when you have sleep apnea and you can't breathe, your brain will wake itself up when your oxygen levels drop down. But if you have a sleeping medication, or in Brian's case, multiple medications in your system, that sedative effect is going to keep you from waking up to breathe. So his airway obstructions were longer and his oxygen levels were dropping lower, especially during REM sleep or dream sleep. And this was happening hundreds of times at night. So the solution was to find and treat the real problem. And sometimes you need some help to get there. You need some help from someone who has expertise to help guide you through that. So once I was able to see what was going on with the sleep study, I could get to work treating the sleep apnea. And, to be honest, it's a challenge to approach insomnia and sleep apnea, but we were able to work together. And after a few months, he was comfortable with his apnea treatment and he was finally able to get the healthy sleep he needed. He successfully weaned off the sleeping pills and he built up more confidence and more trust in his sleep. And as a bonus, he was also able to come off of his two of his blood pressure medications. He was on 3 total, and he came off all the sleeping pills. And over time, his pre-diabetes resolved too. He actually lost some belly fat. And when he would have a rough night, he told me that he finally knew how to take action instead of taking a pill. And I was so happy to hear that. I want to do a little brainstorm exercise together. So if you're with me here tonight, I'm just guessing that you've got a sleeping problem, something's going on with your sleep, and you want some help with that. So this exercise is going to give you a glimpse of what is possible for you and kind of the clarity to help you feel like you're in the driver's seat with your sleep. I want you to think back to the last time you were really getting healthy sleep, meaning you were sleeping enough, you had great sleep quality, and your sleep was consistent night after night. And as a consequence, you felt great during the day. Now, this may have been when you were younger, it may have been when you were on vacation, but I want you to just think of some things that you notice when you are your best slept self. What sleep does is it gives your brain focus and clarity. The brain fog lifts, and you feel like you're operating with a younger, bigger, more flexible brain. Your thoughts tend to be more positive. You can find the words you want to say, and you have an easier time making decisions. Now, all of this sounds fantastic, I think, and I want to hear from the group. What stands out to you? What stands out about the way sleep helps with your thinking? Put this in the chat so other people know they're not alone with the brain fog. All right. What about how you feel after a healthy night of sleep? So one thing for sure is that your appetite goes down. So you're satisfied sooner and you tend to make healthier food choices. When you're not getting enough sleep, your brain thinks you should turn to food for energy. And you tend to choose food that isn't good for you when you're sleep deprived. You're also more vulnerable to emotional eating or habitual eating. Healthy sleep also helps you feel motivated. So you've got your long-term goals in your mind and in your sights instead of feeling like you're barely keeping your head above water. And I know this resonates with people because I've seen it happen so many times. If you fix your sleep, the rest feels easy. And when you're motivated and you've got healthy food and a full night of sleep to fuel you, well, I think people are just about unstoppable. And this is how we're meant to live. So not only will healthy sleep help you stay energetic and productive during the day, but a pattern of healthy sleep, that repeating pattern of healthy sleep night after night is going to improve your long-term health. And this is relevant because I will ask you to think about and decide how you want to live the last 10 years of your life. That is within your ability to influence. And logging night after night of healthy sleep will help support that dream. It means that you're going to ensure that you age in health instead of aging in disease and disability. Literally all of the top fatal diseases, the things that will kill you, are made worse by poor sleep. But I also think it bears mentioning that the heart attack that doesn't kill you, or the diabetes or the Alzheimer's that takes away your quality of life or takes away your independence, is just as bad or even worse than death. Okay. I really hope that that demonstrates how important healthy sleep is. And it's my intention tonight that you get value from this presentation. I want you to walk away feeling like you've learned something. So if I'm hitting the mark, if you're inspired to improve something about your sleep, I want you to type value in the chat for me. I'd like to see how this information is landing. So I've talked about the 4 things people get wrong about their sleep. These are just top 4 off of the tip of my tongue. And I want you to be aware of some of your blind spots. And then with the brainstorming exercise, I really want you to kind of vision what is possible. Just see the horizon, what could improve for you. It's kind of like getting a taste of what healthy sleep looks like. And this helps to empower you to decide how you're going to spend tomorrow, how you're going to spend the last 10 years of your life. Okay. Today is the day to say yes to your sleep health moving forward. And you may do this entirely on your own, or maybe you're in a place where you need some help and support. So next, I'm going to transition to telling you how you can get into my program to get that help and support from me. If you've gotten your answers and you think you've had enough, then this is the time to sign off, because next I'm going to tell you about the Super Sleep Academy program. You can also stick around if you have a question that you want me to answer. I'm going to do that toward the end of the slideshow here. Okay, so the Super Sleep Academy Masterclass is a science-backed and practical program that I've created with my expertise and my experience in sleep medicine and from a life coaching perspective, and also using my background in obesity medicine. It's going to finally help you sleep better so you can feel more awake. And from this training, you can get to know what works for your sleep needs and develop your own personalized program. What are you going to learn? So this is kind of the equivalent of learning how to fish so that you can eat for the rest of your life, okay? I'll talk more about what sleep is good for, which helps you to match your symptoms to the sleep problem that needs attention. I'm going to teach you how to create serenity at bedtime so you can wind down your mind, let that monkey mind go, and also let the tension out of your body. And I'm going to guide you in your daytime activities that support sleep and support sleep health. I'll help you take the nervous out of your nervous system, and I'll give you ways that you can be in step with your natural internal rhythms that govern all of your bodily systems. Now, I'll talk about bed dread and how to get over it. And for those of you who wake up in the middle of the night and it's a problem, there's a whole section on that. I'll help you to know what to do to get back to sleep. And there's kind of a couple of levels of treatment depending on what the situation is. As I mentioned, I'll draw on my obesity medicine knowledge to help you couple your food choices with your sleep quality, or even your wake quality. And if you're still tired after making some changes, I can help you with that too. We're going to solve all of the causes of tired in the masterclass. The masterclass includes 15 on-demand videos. They're just short little videos. They're science-backed, as I mentioned, evidence-based medicine here. So this is really top-tier education and methods that work. This is all the stuff that I wanted to tell you if you were my patient in my exam room and you could have seen me more often like I did with Stella. In addition to that, I'm going to hold an hour-long session weekly for 4 weeks. And with this, I do a little bit of training at the beginning based on the questions that I'm getting. And then I open it up to the group for questions and personal help. And you'd really be surprised at what you can learn from other people's questions. Some things you didn't know how to articulate or you didn't know they were a problem. But when you hear it addressed, I think that's always really valuable. And you get that sense of community because you're with people, you're kind of among friends who are going through the same sleep struggles that you are. So it's a $2,145 value, and I've offered this for $19.97 in the past, but today I'm pricing it at $299. And I'd like to call your attention to the red circle on the slide here. This is an unconditional 30-day money-back guarantee. Okay, so if you get in and you look around at the videos and you feel like this really isn't for you, then you get a money-back guarantee, unconditional. So that removes all the risk. In addition to the 15 videos and the 4 live sessions with me, you'll get my 3 ebooks. And there's also a very nice set of worksheets that follow along with the videos, and you can take notes on the worksheets. This helps to capture the things that you want to remember instead of having to kind of search through the whole thing and watch the videos again. So it really helps you to get that down. So the 15 videos, the 4 live Q&A sessions, all of that's on Zoom, just like we're doing now. You get the bonus ebooks and the worksheets, all of that for $299. Now that's 86% off, and I did double check my math. So this is a lot, really, a lot of professionally curated education and the group sessions on Zoom for a really low price. It's certainly less than the price of a bed and fancy pillows. So I'm going to walk you through what to do. I'm partnering with Dr. Talks for this masterclass. You're going to see the Dr. Talks logo down there. And you want to go to this website. It's www.drtalks.com/webinar/sleep-masterclass. And you should see that screen there on the right. The website is going to be on the next few slides, so don't worry about copying it down quickly. You can enter it into your browser or just write it on paper. Then you click on the orange button that says Join the Masterclass Now. We do have to limit the spots, and this is my sort of private group. Everybody on the webinar tonight has been in the super sleep world, so I'm giving you kind of advance notice. I will be offering this webinar in a couple of weeks, but you guys get first dibs and we can reserve your space. Then there's a short form there. You're going to complete the information, fill it in with your name. You want to pick a good password, and then your address and your zip code for billing. Put in your credit card information and then click the orange button that says Place Order Now. When you get through that, you'll be congratulated, and this is what the page looks like. And you should be congratulated because good sleep is definitely an important part of your health journey. And if you are me and you kind of like a belt and suspenders approach, check your email for your purchase confirmation. You'll see it there within a few minutes. All right, this is a super bonus, and I do want to thank the Dr. Talks people for turning me on to this. When you buy one Super Sleep Academy Masterclass ticket, you're also going to get a buddy pass. That's also called a BOGO, buy one, get one. So that's a buy one, get one free deal, all for $299. So you can gift that to another person you're thinking about who also has a sleep problem. And this is a free second ticket. You can have an accountability partner, or you can just give it to a family member, coworker, neighbor, or even a bed partner, a bed partner who needs more sleep care. So you guys aren't aggravating each other. All right, this BOGO offer is only available if you sign up before the end of this webinar tonight. So I'm going to take questions next. You can ask your question and think about it a little bit, but that buy one, get one offer will only last through the end of this webinar. All right, at this point, if you feel like you want to move forward with Super Sleep Academy, type I'm in the chat. I'd like to see how many people are excited and ready for this sleep transformation. All right, now all the information is on the slide here, and I'm going to open it up for questions now. I'd especially like questions about the material I've presented tonight, but you can ask me anything. In the meantime, we have all the information on the slide here, and I'm going to leave it up a little longer. All right, I'm going to check my message from the team. Yep, just so you know, the link to the Super Sleep MD Masterclass, Super Sleep Academy, is in the chat for easy purchase. You can just click on it from the chat. All right, let me get back to Zoom. Okay, I hope everybody's feeling well tonight. In case you don't know, I live in Minnesota. We are missing the big freeze that's going through the Midwest right now. Hopefully you guys are all staying warm. All right, I'm just looking for chat. And since the link is in the chat, I'm going to go ahead and stop sharing my slides. I can put them up there if that would be useful in a second, but I want to see the chat. Okay. Give me a second to scroll through this, guys. And I really want to say I'm so appreciative of you showing up. It's your evening time, your downtime, your personal time. And so I really enjoy you being here, and thank you for that. All right. I see a lot of me's and agree totally. I love it. Yeah. All right, good deal. Someone has an Aura Chinese replacement for Apple Watch. That's interesting. Some people have the WellView. I like that. Good. Be patient, guys. I'm scrolling to the chat. My window seems very tall. All right. Here's one. I have severe sleep apnea with oxygen deprivation, but I have a new CPAP machine for 2 months. Still need to take Benadryl and antidepressant medication that helps with sleep. Stephen, thank you for that. You're not alone with acclimating to CPAP. It does, it can take a while for sure. And I'll tell you that sleep apnea and treatment with CPAP is so common that that is something that is reviewed in the master class. Okay. I've had less than great outcome with CPAP. Will this program help me be more successful? I would say, yeah, there's a couple of ways to think about that. And this applies for anyone in the meeting today who is using CPAP that's less than throughout the entire night. So I want you to understand that CPAP treats sleep apnea, and it would make sense that if your sleep apnea gets better, your sleep gets better, but that is not always the case. CPAP does not necessarily improve your sleep. What this masterclass is meant to do is improve your sleep, and that can naturally improve your experience with CPAP. That is something that I am definitely well-versed in discussing, and I would be available for questions about CPAP in the course. How long does it take a CPAP machine to help with severe sleep apnea? Good question again, Stephen. The answer is you can get improvement with sleep apnea after one single night of use. I've literally had people wake up the morning of their CPAP treatment sleep study, if they were in my lab, and ask the sleep technician to tell me that it was the best night of sleep that they can remember. So that's like the best case scenario, especially if they go on to use it without too much trouble. And I know some people like that. It does happen. On the other end of the spectrum, some people have difficulty acclimating to CPAP, and it can take a while. It can take, I would say, if you're still battling it at 6 months, there's something wrong. I really like to see improvement within the first month, especially. Beyond that, there's some cleaning up to do, and often that's just misconceptions and mishandling of patients, not enough attention, not enough troubleshooting by people who are knowledgeable. So I'm happy to help you with that if you are struggling. Okay, I tried the CPAP mask, but I rip it off 1 hour in. Have you seen this? And can changing the machine make a difference? Thank you, Igor. Yes. Ripping off the mask is it's a normal response. Your brain is not familiar with the mask. So when you're in that partial awakening, you're kind of in between sleep and wake, your fight or flight nervous system kicks in because the mask is familiar. And as you might imagine, if there's something over your breathing holes, that's going to be a threat. So if you're not familiar with it, you will wake up ripping it off, and it's rather disconcerting. Yes, I do address this. Changing the machine can make a difference in some circumstances, but I would need to know more. I'm attending this for my mom. She lives in Vegas. How often do you offer this program? She has CPAP. My plan is take my turn to look after mom, bring her to Canada. Is this program in Canada? Yes, it is. This program is online. It's my favorite way to work with people. I have people in my world from all English-speaking countries, some non-English speaking countries, but unfortunately, I am monolingual. I don't want to torture anyone with my Spanish. So yes, available in Canada. I'm unable to get to the link. Let's see. I wonder if the team, yeah. So Linda, hopefully you're able to get the link that was hyperlinked in the chat there. What time of day are the live Q&A dates? I'm in California, so you're on Pacific time. Let me give you that detail. The live Q&A sessions with a little bit of teaching, I'm going to just dive into some points or answer questions that seem to come up frequently. There's 4 live sessions. They're all going to be on Thursdays. They're all going to be 6 p.m. my time. I'm Central time, so California is going to be 4 p.m. Pacific time, 5 p.m. Mountain, and 7 p.m. Eastern. These will be recorded. They will be available to you. And so you can see what other people asked. You can see the teaching. And if you submit your question by email in advance, there's a good chance your question will be answered on the video, so you won't miss anything. All right, that's the end of the questions. Let's see. And Linda, I'd love it if you could just confirm that you were able to use that link. So, Zoom is a great platform to use to do these types of meetings. And sometimes when I'm in a group session like this, I'll bring somebody up on video to actually have a conversation with them. So I'll do some coaching live in front of the group. And it's not just all about the specifics of what time to go to sleep and what do you need about your bedroom. A lot of times, everybody, I want you to think about the way you're thinking about your sleep. And one thing that I can tell you is that if you have monkey mind, if you're lying in bed, can't shut your brain off, feeling tense, that's something that I can help you with too. So one of the things I like to say is that if you can't sleep, oftentimes there's just a handful of things that bother you that tend to come up, and you have a different mind after midnight. Okay. So your brain function has a circadian rhythm and you think differently in the darkness. So sometimes the things that keep you awake are not safe. Something is threatening your job, you have a health concern, or something is not enough, not enough time, not enough money, that those things keep you up at night frequently. Sometimes imposter syndrome, kind of feeling like you're out of your element. And then finally, not congruent. This means that you're lying in bed feeling like you should be able to do more, or you're arguing with reality, or you're not sort of in step with your values. So these are things that I do not find addressed in any cognitive behavioral treatment for insomnia. It's not therapy, it's coaching. So I can bring you up on screen and we can have a conversation about that. And I guarantee other people are having similar experiences, and that's really, really quite powerful. All right, this is the end of the webinar, guys. I really appreciate you being here. We're at the top of the hour. So I'm going to go ahead and sign off. Again, we're going to have the buy one, get one offer if you sign up now. You can go to drtalks.com/webinar/sleep-masterclass. It's in the chat there. One more question here. Mom has been assessed by pulmonology, but need to do when it seems her prescription with CPAP settings or the machine is not the right, what to do? Okay, CPAP settings or machine is not the right one. It's been a year now. Wow. Yeah, it sounds like I can't advise you. I'm certainly a doctor. I'm not your doctor, but I think the very best next step is to write down what she's experiencing, get as detailed as you can, and bring that to her sleep medicine doctor or the pulmonary specialist. There is a little bit of a difference between a pulmonary doctor and someone who's certified, boarded, and certified and trained in sleep medicine. So I always say, guys, if you don't have a great relationship with your physician, it may be time to change. There's more to doctoring than just looking at numbers and just listening to symptoms and having an output. If that were all it was, then I think AI would be replacing us. But there needs to be warmth and compassion and listening coming from your doctor. So I would really encourage you to take those issues back, and hopefully you can get some help with that. All right, guys, it's time for me to sign off now. I certainly had a great time giving you this information. As you can tell, this is my passion. This is something that I really enjoy and find great pleasure in helping people. So I hope to see you. I hope to meet you and interact with you in the Super Sleep Master Class, the Super Sleep Academy. Take good care, guys. Have a great night. Bye-bye.